Exactly 6 minutes past the top of the hour. You're right in time for our second and last conversation. This Tuesday morning, we want to talk about matters health. On this Health Tuesday, our focus centered on the state of infertility in Kenya. At least so far, we knew that 1 in every 5 couples suffered from this. So then we want to look at whether the statistics have changed, what you're doing as a country, and the treatments that are available when it comes to matters infertility. Dr. Sarita Sukhija, who is the founder of Myra IVF Center with over 20 years of experience on these matters. She'll be helping us understand more about matters of infertility and the treatment therein. Welcome to the program, Dr.
Thank you, Doreen, for having me here.
You're welcome. Let's just start with understanding the treatment that is IVF before we come to the center. Talk to us about what treatment is IVF, what does it entail?
You'll see almost 20 to 25% of the couples suffer from infertility. And when do we label it as infertility is when they're staying together and they are trying for pregnancy and they have not been able to conceive naturally. Even after trying for 1 year, that is when we say that the couple, either the wife or the husband, anyone can have some problems, and we start looking into the reasons as to why they are not able to have pregnancy. So IVF is the it's actually the last resort in terms of infertility treatment. There are a lot of other treatments available. Basically in IVF, what we do is we try to stimulate the eggs in the ovaries of a female which are there. Every month a fresh crop of eggs comes up, like there are 5 eggs in left ovary, there are 5 eggs in the right ovary. And so we try to stimulate them, and the injections are given for that, which are the hormonal injections. The treatment begins from the beginning of the cycle. And the injections are given for about 10 to 15 days to stimulate the eggs. And once the eggs are ready, we take the eggs out under a short anesthesia, and the same day the partner is asked to give the semen sample, and the eggs are fertilized outside the body inside the IVF lab. So basically what is not happening inside the body, we have to let the egg and the sperm meet to have an embryo. And once there are enough embryos, we transfer about 2 to 3 embryos in the uterus. So that is basically the whole IVF process, and it needs to be regulated and monitored properly so that there are no complications.
And of course it's one of those very costly treatment, but we'll come to that momentarily. But then again, the treatment center, Myra IVF Treatment Center, clearly just, largely about what you've talked about. But then when was it founded and what was it set to mitigate?
So basically I was practicing in India for 20 years and Myra IVF Center was there also. So when I moved to Kenya, I saw there was a need for a good center which can provide all the facilities under one roof. Especially not only the IVF, ICSI, but there are some advanced treatments which are available now in the developed countries, like laser hatching, the PGS, that is pre-implantation genetic screening, and all these treatments which are not available, especially the egg freezing also, which is the need of the hour for a country like Kenya. So I wanted to make a center which can provide everything at a reasonable cost. Of course, the cost is a major deterrent for the couples to, go for the IVF treatment. So that was the vision that we wanted to start a setup which has all the latest facilities under one roof, with the modular lab and with the HEPA filters, which can give you the best embryos and the best results. So that was the whole idea behind starting the Myra IVF Center.
Okay. So it was also to just try and see how you can assist and alleviate that burden of cost.
Yeah.
Really quite costly when you talk about IVF.
It is a little expensive.
Yes. So then from your practice, over 20 years, just dealing with issues and matters of infertility, what would you say is the really main cause of infertility amongst couples?
Yeah, so if you look at the causes of infertility, we can categorize into the female causes and the male causes.
So it's different for the genders?
For both, yeah. So in the female, there could be a problem with the reproductive organs, like there could be problem with the uterus, there could be problem with the ovaries, or there could be problem with the tubes. So if you look at the uterine factors, like the factors which can affect the woman not to get pregnant, what I see in Kenya, fibroids are very common here. I think I would say almost 1 in 3 or 4 girls have fibroids, and mainly the reason could be genetic only. So if there are...
the reason for fibroids could be genetic?
Genetic, okay. Yeah, because it's usually passed on from mothers to the daughters.
Right.
So that could be the main reason, plus there could be some environmental factors or other factors, but genetics is the main reason. So I see every patient I get, almost every second patient comes to me with the history of fibroid, and they have undergone surgery, not even 1 surgery, but maybe 2 or 3 surgeries, because the fibroids can regrow. That is one of the important reasons which we find in the uterus that can be the reason for infertility. Now, the fibroids, not all the fibroids cause infertility because, you know, there is a space in the uterus where the embryo has to grow. If the fibroids are occupying that space, the fibroids can be in the cavity, they can be outside the cavity, they can be in the muscle, they can be multiple, they can be single. So the fibroids which are actually occupying the space where the baby has to grow, that is when we need to look into it and it needs to be removed.
Okay.
And the other reason the fibroids can cause infertility is that they take away most of the blood supply from the uterus. So the blood supply to the embryo gets compromised and they are not able to conceive. That is one reason in the uterus. Then there could be, if somebody has undergone DNCs like miscarriages or abortions, there could be adhesions, there could be infection in the uterus which can prevent the implantation of the embryo. If you look at the ovarian causes, like in the ovaries, there could be, see, a woman has to have 1 good egg to get pregnant. So if she is not making a good egg, that means she is not ovulating, then that can lead to infertility. And the main reason in the young girls which causes anovulation, meaning they are not ovulating, is the PCOS, which we are seeing a lot in young girls nowadays. And the causes can be many, like it can be the genetic factors, it could be the diet, the stress, the obesity. There are a lot of factors which can lead to polycystic ovarian disease, in which a woman has a lot of hormonal imbalance and they do not make a good egg. So they will need assistance to have good egg first, and then it can be fertilized. There could be endometriosis, which is again characterized by painful periods in which, you know, the woman has endometriotic spots outside the uterus which bleed and which can form cysts. So it can affect the eggs, it can affect the uterus, it can affect the tubes. So those could be the reasons. Then looking at the tubal factor, meaning if the tubes are blocked, and they can get blocked because of the pelvic inflammatory diseases. So that is, again, I've seen it's quite common here in Kenya. People come with the history of miscarriage or some infections, and we get their tubes checked, the tubes are blocked. So if the tubes are blocked, obviously a girl cannot get pregnant, because the egg, once it is released from the ovary, it has to go inside the tube where it gets fertilized. So those are some of the reasons in a female which can lead to infertility. If you look at the male factors, in the males basically there is one important thing, that is the sperms. And in terms of sperms, we are looking at the number, the morphology and the motility.
Sperm count.
Yeah.
Okay.
So if the sperm counts are lower, and it is seen that nowadays because of stress or work, the computers, the mobiles, the drinking and the eating habits, the sperm counts are going down. So if the sperms are not enough, then again a person, the couple can have difficulty in conceiving. And if the sperms are not motile enough, meaning they cannot reach the egg to fertilize it, So there are a lot of reasons which can be responsible for infertility. So we need to look at the reason, what is the reason, and then accordingly we start treating them.
Treatment.
Yeah.
Right, well said. Now, since you've touched on ovulation, I think that's a good place for me to even ask you this one. And maybe perhaps you can demystify it if it's a myth or not. We've sometimes heard that if you have consistent cycle, your menstrual cycle, it comes every month, you've never missed it, and the flow is good, 4 to 5 days, it's just good enough, then chances are you are good and fertile. Is that true? Because again, we've had stories of some who really have those good cycles, but then later on, when they want to have children, they realize for one reason or the other, they really can't quite have. So is this a factor in one way or the other?
Yeah, see, if a girl has a regular cycle, it is an indication that her hormone levels should be okay, and she should be ovulating. That is one of the good factors that she should not have any problems in conceiving.
So it's, let's just hold it there. So it's actually positive.
It is positive.
Good chances are the day or the time you really want to get pregnant, you're good to go.
Yeah, yeah,
all right.
That is good, and that is the thing that we suggest people who do not get regular cycles. Like, you know, you'll see the girls skip cycles for 2 months or 3 months, especially in the PCO.
Yes.
So we tell them whether you have to take tablets on a regular basis.
Have very lengthy flows.
Yeah, yeah. So they should, their main aim should be to get the regular cycles, to get your hormones regular and ovulation.
All right, I hear you. So at least now we are clear.
That should be the goal.
We know better. What about for those who would want to delay pregnancies? Talk about instances, someone wants to advance their careers, someone just wants to enjoy life in their 20s and 30s, and they're thinking, if I want to have children, perhaps late 30s, early 40s, what is the implication of that in relations to infertility?
See, nowadays we are seeing the girls are postponing pregnancy because of the education or the career, or sometimes they're not able to find a right partner, and obviously nobody wants to rush into a marriage and have children. So in those girls, I always say, please go and freeze your eggs. You can delay your pregnancy for as long as you want, make your careers, finish your education, settle with a nice partner, but freeze your eggs, because every woman is born with certain set of eggs, and when you are ovulating, your eggs are finishing, and a stage comes when you will left with no eggs. So there is a test available now which is called anti-Mullerian hormone, AMH. It's a fertility reserve test. It's a simple blood test. You go to any lab, it is available at our center also, and it is available at most of the fertility centers. It's a simple test. Just go and give your blood and check your levels. The normal levels range between 1 to 4 nanograms per ml. And if your levels are lower, then it should ring an alarm that you should go and freeze your eggs. Because if you have frozen your eggs at, say, age 32, 33, and you're not planning pregnancy anytime soon, those eggs can be frozen for as long as you want. It can be 1 year, it can be 2 years, you could be ready for pregnancy after, say, 5 years. You can use those eggs at the age of 40 to fertilize them and have a baby, a healthy baby. And now very good techniques are available, which is called vitrification, in which we can freeze the eggs very fast, and they can be kept frozen, and once we take them out, we can get 100% survival. Earlier it was not available, but now it is available at our center, and we do it very often. And I encourage all the girls who are in their mid-30s and who are not planning pregnancy to please go and freeze their eggs. It's not very expensive. We have tried to bring down the prices. It's sort of the, I would say it's the best insurance that you can give to yourself, because we get girls by the age of 40, 42 when they are ready to have a child, and then there are no eggs. One, the number, plus the other thing is the quality. As a woman ages, the quality of the eggs gets compromised. The older eggs do not give you good pregnancies. You will see, even if a girl gets pregnant, if the embryo is not normal, which we call medically aneuploid embryo, that embryo will start growing, but it will die at some point, and you end up in miscarriage. So if you don't have eggs, then it becomes very difficult to get the eggs, especially in the girls like who are in the perimenopausal age group. The new treatments like the PRP, which is platelet rich plasma, or the stem cells, those are available at our center. We are doing for women who really want to try with their eggs. But your own eggs are the best eggs, that I would say. So please freeze your eggs. I recently read Jennifer Aniston had mentioned somewhere that she was trying for IVF, and if somebody would have advised her to go and freeze your eggs, she would have done anything. Now the ship has sailed. Meaning, if there are no eggs, then it becomes really difficult, and if you don't have eggs, then you have to take eggs from somebody else, that is the donor eggs. And obviously everybody wants to have their own biological child. So please, I tell every girl that please freeze your eggs. For that matter, even males. So the egg freezing is not only when you are postponing the pregnancy. It comes in handy when somebody has cancer. Now the cancers can be detected at an early stage. They can be treated, and women or even men do live longer. So if you are undergoing the treatment for cancer, the chemotherapeutic agents or the radiotherapy, those are very toxic to the gametes, to the ovaries or the sperms. They will really kill your eggs and sperms. So before you start any kind of treatment, please go and freeze your eggs. You might want to have a child later when you are okay, and then if you have taken those radiation or the chemotherapeutic agents, then you might not have eggs. So it comes in handy there also. For men also, if anyone is diagnosed with cancer, it's better to go and freeze the sperms, and for women, go and freeze your eggs and then start the treatment.
So this one actually does cut across. So then what is the cost implication? Because at least from what I'm drawing from you is that this is not just for any woman or even man, so to speak, who wants to take time, advance their careers, even in some form of ailments and diseases, as you rightfully put, like cancer. You might need to be thinking of freezing your eggs for later purpose. What is the cost then?
So if you look at the semen freezing, it's not expensive, because the men have to just come into the clinic, give the semen sample, and we can freeze it. So it costs about 10 to 15,000 shillings per month. Or we can even, cut, if somebody is freezing for a longer duration, we can bring the cost down. But for the woman, it's not that easy. To get the eggs, we have to first stimulate them. We have to get all those eggs.
So the process is different from...
Yeah, for females, it's different. So they have to undergo the injections, the hormonal injections. Now the cost of injections is high, especially I've seen in Kenya, and I don't know how it can be brought down. I mean, you can ask the government agencies to reduce the taxation or whatever. The injections are expensive. So they are given injections for almost 10 to 12 days when the eggs are ready, and we monitor them on the ultrasound. And the injection cost is approximately 100 to 120,000 Kenyan shillings for 10 days. So every day the injections would cost about 6,000 to 7,000. And once the eggs are ready, now we have to go to the ovaries and we have to pass a needle, so it is little painful, so it has to be done under anesthesia. A woman is put to sleep and we go inside the ovaries, and then we take the eggs out, and then those eggs are cleaned in the lab, and then they are frozen. So in one round, maybe if a girl is young, we can get say 8 or 10 eggs, and if the number of eggs is not enough, then we have to do a stimulation again, so that we have at least 15-20 eggs frozen, which can be used later when they want to have a child. So because of the stimulation and the procedure to be done under anesthesia, it becomes a little expensive, but still we try and give them the best price that we can, say between 250 to 300,000 Kenyan shillings.
It's really, quite pricey.
It is.
It's no mean feat.
Yeah, because there are a lot of things involved.
And also it's really quite intensive, especially for women. And so that's why we say matters of fertility. Infertility is no mean feat, the kind of costing therein. But also, what is the relationship between older women and miscarriages? What really is that relationship?
See, as I said, in older women, the quality of eggs gets compromised. And you will see by the time a woman reaches 40, and if we take out the eggs and we make the embryos and we send them for testing, we can actually test the embryos. Once we have the embryo, we can take a small biopsy from the embryo, and it is sent for testing, which is called PGS testing, that is pre-implantation genetic screening, in which they check the number of chromosomes, and also the diseases can be checked in that. So it depends for what we are sending. And as I said, if a woman is 40 and say we test 10 embryos, you would see almost 50 to 60% of the embryos will come out abnormal. Now, if she conceives naturally and if the embryo is abnormal, then obviously the chances of aneuploidy are higher, meaning the abnormal chromosomes are higher. And so those embryos will not grow. Either they start growing. If they are abnormal, they will stop at certain age, and the woman will end up with miscarriage. Or the chances of the abnormal babies like Down syndrome, etc., that is also high in the older woman because of the same reason, because the rate of aneuploidies goes very, very high. And that is also the reason why IVF results start falling down as a woman ages. So if a woman is younger, say in 25, 30, 35, the IVF results would be better because we have good embryos. Because that is something which is not in our control.
So let me get it. So even IVF as a treatment is cut out for age?
Yes.
Okay.
Yes. That is why we say if you are planning IVF in the later age group, say after the age of 40, 42, 45, you'll see I get a lot of patients who have failed IVF cycles.
All right.
Meaning you might get the embryos, but once you put them inside, if they are abnormal, they will end up with failure. So for those women, it's very important to check the embryos and send it for testing. So in those cases, we try and try different kind of protocols now which are available, like the minimal stimulation protocols, in which because the eggs are not many, whether you give too much of injections or you give minimum dose, you are going to get those 2 or 3 eggs. So we get those eggs and we use a small dose of injection so that we can have better egg quality. And we keep pooling the embryos. We might have to do 2 cycles or 3 cycles. In one cycle, I get, say, 1 embryo. The other cycle, I get another 1 or 2 embryos. So we pool the embryos, and then those embryos are sent for testing. Say out of 5, I get only 1 embryo which is normal. So if I would have transferred the other embryos which were abnormal, you would end up with failure. Yeah. Sure. So it is better to pool the embryos, check them, and get 1 good normal euploid embryo and then transfer that, then the chances of pregnancy are very high.
Okay.
So we are doing this routinely for the women, older women, and it is advisable rather than, it's not only financial burden, but it's a lot of trauma, emotional trauma for the woman if she's trying and she doesn't conceive.
Yeah, and I mean, we can well agree that not everyone is actually aware of what you're saying, freezing of eggs early enough. There are those who already got into 40 something thereabout, perhaps even early 40. Maybe they're just hearing of this information right now, and here you're saying that IVF is really cut out for sort of younger women in the 20s, 30s, for example. So do they have any other existing options? if they're trying to have children and perhaps they can't have it in the, normal way, so to speak?
Yeah, so when a young girl would come to me, I would see whether her cycles are regular, whether she is ovulating.
That's the first thing you check?
Yeah.
Okay.
And then we do certain hormone tests to see that there is no hormonal imbalance. And then we monitor her one natural cycle, whether she is making egg on her own or not. So we try to tell them that now this is the best time, this is the fertile days when you should try. Sometimes the girls don't know that their eggs get ready little later. So the thing with the egg is that once the egg is ready and it is released, it remains alive only for 24 hours. So you have to have you have to utilize that time to get pregnant. So we can monitor the egg on the ultrasound and we can tell them that, look, now your egg is ready, go and try for this 2 days, and they can get pregnant if the sperms are okay. So that is one thing. If naturally monitoring, it is called timed intercourse, meaning we time everything. That is the first thing that you would do in a young girl. And if that doesn't help, then we can give them some tablets which can help in making good eggs, say 1 or 2 eggs. There are a lot of fertility tablets available, but again it has to be monitored that she doesn't go into any complications. If that also doesn't work, then before you start all these things, we have to be sure that her tubes are open. Sometimes, people start the fertility treatments and they don't know whether the tubes are open or not. Then everything goes waste. The tubes have to be checked, which can be checked by a specialized test in which they put the dye and you can see that the tubes are open and the dye can be seen. If that doesn't work, the tablets, then we move on to the other step that is called IUI, which is intrauterine insemination, meaning we give them some tablets as well as injections, so that instead of 1 egg, she has maybe 2 or 3 eggs. And once the eggs are ready, we take the sperms and we wash them in such a way that the dead sperms are separated and we have good motile sperms. And we go, like suppose this is the uterus, so we can go up to the uterus, just close to the opening of the tubes, so the sperms can quickly swim to the egg. That's the IUI. So that's not very expensive, but the only thing is that a couple needs to come for regular follow-up, and the pregnancy results with IUI all over the world are maximum 20-25%, not more than that.
All right, I hear you.
Yeah.
And I was about to ask you, so which other form of treatment could be available and is not costly, because you can agree that IVF is not cheap, and you've talked about IUI there. Also, I came across an article in 2021 where it was well enumerating the kind of number of procedures that you have done as a doctor and as a gynae, 80 to be very specific, and out of this 45 successful. So then one would ask, what about this 35?
Yeah.
Of course it's a significant number, I mean almost 50% there.
Yeah.
But then again, why do these other ones become unsuccessful?
Yeah, see, it's not only here, but all over the world you will see in the best of centers, the results are between 30-35%. If a woman is younger, of course, the results can go to up to 60-70%
and I'm hearing
also.
a lot of young women.
Yeah, so young women, they should, they should realize that, their eggs are very, very important. Don't take it lightly, because as you are aging, I know nowadays the girls are very passionate about their careers, and they are very passionate about the education, and they are very particular about choosing a right partner, and they don't want to settle unless, which is right, but then you have to see that your biological clock is ticking. And you now you have means wherein you can stop that biological clock. It is in your hands. Just go and freeze your eggs, and then do whatever you want to do, and come back to me when you want to have a child. If you have frozen your eggs, the chances are very good that you will have child with your own eggs. So that is one thing
Yes.
which the girls need to keep in mind, and I keep stressing upon, because we also really feel bad if there are no eggs, and then we have to tell them that look, there are no eggs, you will have to
weighs down you as weighs you down as a doctor. I understand, and I'm just about to ask you what your clarion call is, or basically pick your headline thoughts as we conclude. But over time, I've had freeze your eggs as a
freeze
young
your
girl.
eggs, that is very, very important nowadays for the young girls especially.
Okay. Thank you so much for your time. Good place to end this conversation, and thank you so much for the insight, at least for those that were watching, the young girls, for those that are not ready for now, understand what to do next. Thank you so much.
So we are located at Myra IVF Center, which is in Westwood Office Building, Westlands, and you can call on 786-656-236 to book appointments, and we are there to help you with all the latest technologies that are available in Kenya.
Also just consultation.
Consultation, any kind of help, we are there.
All right, thank you very much.
Okay.
I have been speaking to Dr. Sarita Sukhija, who is the founder, Myra IVF Center. Of course, matters of infertility taking center stage in this conversation, just trying to understand where we are as a country, and perhaps what we can do to bridge that gap and reduce the instances and perhaps cases of infertility amongst couples in Kenya. Good place to end this conversation, and ultimately, good morning, Kenya. Thank you so much for your time, holding us through from 6:30 up until now. We sit ground for the next program of the day till tomorrow. Good morning.